We now have a deadline for the Biden administration's vaccine mandate. Workers at companies larger than 100 people must be fully vaccinated by January 4th or be subject to weekly COVID testing. The White House says about 80 million private sector employees fall under the requirement. President Biden initially proposed the, quote, emergency temporary standard mandate back in September, but some Republican lawmakers are critiquing the move. Carter Evans reports.
Tonight, tough new vaccine measures that are expected to impact 84 million workers. The Labor Department is now requiring employers with 100 or more employees to get their workers fully vaccinated or test them for COVID at least once a week. Unvaccinated workers must also wear a face mask in the workplace. Employers who fail to comply by January 4th could be fined nearly $14,000 per violation.
Thank you for joining us today.
But at a committee hearing in Washington today, some senators blasted the idea of more rules to fight COVID.
Back away from mandates. Educate, encourage, inform. Don't be divisive.
In San Francisco, officials are moving forward with plans to extend the city's indoor proof of vaccination requirements to children 5 to 11 years old. That age group became eligible for Pfizer's kid-size vaccine this week. San Francisco already has a mandate in place requiring everyone 12 and up to prove their vaccination status before entering places like restaurants, gyms, and sporting events.
Guys, how are you? Just need proof of vaccination, please.
A similar mandate began today in Los Angeles County. Customers at indoor bars, lounges, and nightclubs now have to show proof of vaccination or remain outside. Alex Manos is co-founder of Rocco's Tavern in West Hollywood.
It's difficult to tell somebody because of your medical choice, you cannot come in here and eat pizza or eat some wings or have a beer or watch a game.
So you have to become enforcers?
At this point, yes.
Whether you like it or not?
Yes. As a business owner, turning customers away is not what we want to do, ever.
Starting next week, almost all businesses in Los Angeles will be required to check vaccination status, and there will likely be pushback. This is the burger chain In-N-Out, and in some Northern California locations, well, they refuse to check vaccine cards, opting instead to close the dining rooms for everyone. Lana?
Interesting. All right, Carter, thank you. For more, I want to bring in Dr. Anand Swaminathan. He's an assistant professor of emergency medicine at St. Joseph's Regional Medical Center. Dr. Swaminathan, always great to have you in the show here. So I'm wondering, in your professional opinion, are vaccine mandates the most efficient way of getting this pandemic under control?
I think right now we've run into the point where the mandates are not only working, but they are necessary in order for us to get as many adults vaccinated as we can. We see time and time again with the vaccine mandates, whether it be in like the Kaiser system, whether we see at Tyson Foods, where 60,000 people got vaccinated after the mandate was put in place, or with New York City workers, where the rate of people that are unvaccinated and choosing to remain unvaccinated is less than 6%. The mandates work. It helps to show people the right thing to do to protect themselves and their community. So I think, if anything, we need more mandates. We need a travel mandate. If you're going to get on a plane, you have to be vaccinated. And I think soon we should be seeing school mandates as well for either the teenagers to start and then extending it to that younger group to keep the students safe, to keep their peers safe, and to keep the teachers safe too.
So I want to ask you about hospitals in Colorado. They're now allowed to turn away patients as the state is experiencing a COVID-19 surge. Elsewhere in the nation, the CDC reports that cases and deaths have been dropping. How much are you concerned about these regional discrepancies, and what are you seeing at your hospital in New Jersey?
We've been very fortunate that we have been seeing low levels since last winter, since the end of last winter. And that's because I work in a place with very high vaccination rates. People have taken this pandemic extremely seriously, gotten vaccinated, continue to do the right thing to protect each other. And so we're not seeing a ton of cases. We're not seeing a ton of really sick people either. Nothing like what we saw last winter before vaccines were widely available. And what we're seeing in Colorado really breaks my heart as an emergency physician, because what we pledged as emergency physicians is to take care of any patient anywhere, anytime that they need. And to see being put into a position where you can't do that because your system is so overwhelmed is an awful thing for any physician, any nurse to ever have to run into. But this is the kind of situation we're going to see continue to mount going into the winter, unless more people take this as seriously as my area is taking it and get vaccinated as soon as they can.
Speaking of vaccinations, we're a couple of days in now. How has turnout been for getting younger kids vaccinated?
Well, we're seeing this really kind of build up. I've heard from lots of parents who are refreshing their computer every 5 seconds, trying to find an earlier appointment. I made appointments for my kids on Sunday and Monday. It was the best I could get. And then I found out that our local middle school is actually going to do vaccines tomorrow. No appointment is needed. So I'm going to be bringing my kids there. That was the earliest I can get it done. I wish I could have done it yesterday, Lana, to be absolutely honest with you. And I think that lots of parents are feeling that push. Let's get our kids vaccinated. Let's protect them, especially going into the holiday season where we want to be seeing family. We want to spend time inside. This is the best way to do it. So let's get our kids vaccinated. And my plea to parents is to do it as soon as you can. I've heard from a number of people about how their kids were just about ready to be vaccinated and they got COVID. And that's a real shame. So don't wait. Get vaccinated as soon as you can.
And now that children can be vaccinated, how concerned are you about cases increasing this winter, or are you thinking that the pace of vaccination and the enthusiasm that we're seeing from so many parents will help to keep those levels low in schools in particular?
I hope it will, but I think the same inequalities that we see across the country in terms of where vaccine uptake is high versus where it's low are going to be echoed in kids' vaccine rates as well. And so you're going to see areas like where I am, where people are going to get their kids vaccinated. They're going to be in a better position going into the winter. And some parts of the country are not going to be in a good position. And as it gets colder, as more people are forced indoors, and as there's two massive holidays come up with huge amounts of travel, we're going to see rates in kids spike. And, this isn't just about the kids getting sick. It's also about them missing school. It's about them getting their peers sick. And it's about long COVID. These are all things that are now preventable by getting vaccinated.
Well, I want to ask you about Moderna because they reported on Thursday its pediatric COVID-19 vaccine information. They say that they are 80% effective in kids ages 6 to 11 after the first dose. How beneficial will it be to have two vaccines available for kids, and how soon might that happen?
I think it'll be massively beneficial. I think it's still going to be a little while. The FDA has asked for more data to come out of Moderna before they're going to be ready to really review that. And this is really a press release. It's an investor release. We haven't seen the actual data here, which we do need to see how effective this is. But it's going to be helpful. I'm not sure how helpful it's going to be in the U.S., but I think it will be helpful outside. And this is obviously a global pandemic. We need to be worrying about how do we get everybody else around the world vaccinated, including kids. And so getting a second vaccine approved is going to be hugely beneficial around the world, although it might not have a huge effect within the United States.
Dr. Swaminathan, thank you, of course, for coming on the show and for all that you do.
Thank you.